Hey guys, Dr. Brown from Brown Plastic Surgery. Welcome back. I want to talk about a topic today. Two problems that can happen after breast augmentation or breast implants that we commonly see are bottoming out and double bubble deformity. I want to talk a little bit about what is the difference between the two and why do they happen. So the first one I want to start out with is going to be bottoming out. What is bottoming out? So when we do a breast augmentation, most of the time we're making an incision in the breast crease and we make a pocket beneath the pectoralis major muscle to place the implant. And what happens over time is that implant will apply pressure to the breast skin and the breast tissue such that things stretch. Now clearly, if you have poor quality skin, you're gonna stretch faster than someone who has really good quality skin. So what happens with bottoming out? What's the problem? We're going to show a series of pictures here to kind of explain what I'm describing. But once the implant is placed beneath the breast and under the pectoralis major muscle, over time what can happen is the skin stretches and then the implant begins to descend into the lower pole of the breast. And what we see when that happens is stretching of the skin from the nipple to the fold. That's called the nipple to fold distance. It's a measurable distance that we take, and we're looking at the quantity of skin between the nipple and the fold. So in this problem, the breast crease is in a perfect position. There's nothing wrong with it. What's happened is the skin of the lower pole of the breast has just stretched. So again, that happens in people with very poor skin quality or breast tissue quality. How do we fix that? Usually the fix for that is to just resect the lower pole skin to shorten the distance between the nipple and the fold. And then sometimes I'll use a piece of mesh internally to also support the implant because the breast tissue is too weak to support the implant itself. So that's what bottoming out is. So again, in bottoming out, the issue is stretching of the skin from the nipple to the fold where the implant descends into the lower pole of the breast. So let's shift gears and talk a little bit about a double bubble deformity. Now, a double bubble deformity is a problem with the inframammary fold. This, unfortunately, is most commonly surgeon error. And the reason is you have to physically release the fold from the underlying chest wall in order for a double bubble to occur. Now, I have seen a few people who did not have the fold violated, but because their tissue was so weak, the implant auto-dissected past the fold and created what's called a double bubble deformity. So what happens in a double bubble deformity? So here's the error that occurs. Maybe someone who doesn't have a lot of experience, they're new out, they're not sure what they're doing, unfortunately, or haven't done enough breast augmentations to understand that this could be a problem. When they make an incision either in the breast crease or below the breast crease, they accidentally dissect from below the breast crease through the fold, and they actually release the fold when they're creating the pocket under the muscle. Initially, everything looks great. The implant is sitting high on the chest wall, the muscle is tight, everything is in good position. But then what happens is slowly as that implant applies pressure to the muscle and to the skin, it's gonna start to drop into the lower pole of the pocket. When it does that, it will actually at some point displace the fold, and part of the implant goes below the crease, and then the crease rides up on the lower pole of the implant, creating what's called a double bubble. And what I mean by a double bubble is there's a bubble below the fold. Here's the fold because it's been violated and lifted away from the chest wall and the implant dropped below, and then the bubble of the implant above. So the crease actually creates a double bubble in the implant where you have a bubble below and a bubble above. So again, the problem there is the implant has literally dropped below the native crease because it was released, and the crease rode up, causing what's called a double bubble. So how do we fix a double bubble? That's pretty straightforward. We go into the pocket, we identify the native fold, we suture it back down to the chest wall, and once again, I'll oftentimes use a piece of mesh to support that repair so that it doesn't dissect past the fold again. So that is a double bubble deformity. I hope that explains the difference between two things that we don't commonly see, but we do see it, and there are things to do to fix that. So if you do have that, feel free to reach out to my office. I'm happy to fix the problem for you or to guide you in the right direction. Again, guys, Dr. Brown from Brown Plastic Surgery, thanks for joining me today. Have a great day.